Hello, it's Dr. Dawn Marcus. If you've been reading the papers, the medical journals, or turned on the TV this week, you've probably heard some scary reports about an increased risk of heart disease and strokes if you have migraines. If you're one of the 12% of adults with migraines, that can really be pretty frightening to hear. So let's get to the facts. What's the real story? Well, true enough, journals in both the United States and Europe have published studies showing that if you have migraine, you do indeed have about double the risk of having a heart attack or a stroke. But that's only part of the story. There have been some important studies published in the journals Neurology and Cephalalgia that show that it's not just the genetics of having migraines that's the issue. The issue may be that people with migraines tend to have a lot of other heart disease risk factors. These studies show that if you have migraine, you have an increased risk of having other conditions like high blood pressure, diabetes, high cholesterol, and even smoking is more common in people who are migraine sufferers. So what's the take-home message here? Well, the take-home message should be, don't worry about heart attack and stroke and do nothing. What you need to do is remember, if you have migraines, you do have an increased risk for having heart attacks, heart disease, or strokes. And what you can do is take that information to motivate yourself to decrease those risk factors that are very important for increasing that risk. So doing things like keeping your weight in check, exercising regularly, making sure your blood pressure is normal, your blood sugar, and your cholesterol are under control. So talk to your doctor if you have migraines. Don't worry about heart attacks and strokes. Do something about it. Cut down on your cardiovascular risk factors, whether you have migraines or not, but knowing you have migraines should be the added motivation to get you heart healthy.